Rescue breathing and CPR or cardiopulmonary resuscitation. Take note, improper CPR or CPR performed on a person whose heart is still breathing can cause serious injury. Never perform CPR unless first, the victim has stopped breathing. Next, the victim has no pulse. Lastly, there is no one else with training in CPR who can do it. Step 1. Check for consciousness. Tap the victim by the shoulders and shout, "Are you okay?" If he or she does not respond, roll him onto his or her back after making sure that he or she has no spinal injury. If he or she has spinal injury, gently roll his or her head, neck, and shoulders together as a unit until he or she is on his or her back. If the victim does not respond, call for help. Step 2. Open the airway. Check for breathing. See if the victim's chest and abdomen are moving. Listen and feel for air moving out of the mouth. If the victim is not breathing, open the airway. First, turn the head to one side and clear any foreign material from the mouth with your fingers. Second, place one hand on the victim's forehead and tilt the head back gently. Third, place the fingers of your hand under the chin and lift to pull it forward. Step 3. Begin rescue breathing. First, pinch the victim's nostrils shut with your thumb and forefinger. With your other hand, continue tilting the chin forward to keep the airway open. Second, take a deep breath and place your mouth over the victim, making a tiny C. For an infant, place your mouth over the mouth and nose. Third, blow air slowly until the victim's chest rises. Take 1.5 to 2 seconds to give each breath. Remove your mouth from the victims and take a deep breath between rescue breaths. Allow the victim's chest to fall and feel the air escape. Fourth, give 2 full breaths, then check for circulation.
Step 4. Check for circulation. Number 1. Locate carotid artery in the neck. Second, find the boy's backs or Adam's apple. Slide the tips of your index and middle finger into the groove beside it. Third, feel for a pulse for 5 to 10 seconds. If there is no pulse, begin chest compression. If there is a pulse, continue rescue breathing only until help arrives or the victim starts to breathe on his or her own. If he or she begins breathing again, he or she still needs to be seen by a health professional. Fourth, give rescue breaths. For adults, age 9 and older, 1 breath every 5 seconds. Step 5, begin chest compression. For adults, kneel next to the victim. Use your fingers to locate the end of the breastbone or sternum, where the ribs come together. Place 2 fingers at the tip of the breastbone. Place the heel of one hand directly above your finger. Second, place your other hand on top of the one that is in position. Do not allow your fingers to touch the chest as that may damage the ribs. Third, strengthen your arms, lock your elbows, and center your shoulders directly over your head. Fourth, press down in a steady rhythm using your body, weight, and keeping your arms locked. The force from each thrust should go straight down into the sternum, compressing it to 1.5 to 2 inches. It may help to count 1 and 2 and 3 and 4, up to 15 compressions. Give 1 downward thrust each time you say a number. Lift your weight but not your hand. Open the victim's chest on the up stop. Fifth, after 15 compressions, quickly do head tilt or chin lift and give 2 full, slow breaths, taking 1 breath in between. Sixth, Repeat the 15 compressions. 2 breath cycle 4 times. Check the pulse again. If there is no pulse, continue rescue breathing and chest compression until help arrives.
You found a person lying on the ground, not moving. You should survey the scene to see if it is safe and get some idea about what happened. Then begin doing a primary survey by checking the airways, breathing, and circulation of first aid. Remember, when using a real person as a victim, do not make mouth-to-mouth contact or give actual rescue breaths. Unconscious. Bumps and bruises, first aid safety measures. First aid for cuts and scrape. Step 1. Wash it. Wash the wound with mild soap and lukewarm water. Step 2. Clean it. Use an antiseptic cleaning solution to clean the wound or apply antibacterial cream to prevent infection. Step 2. Cover the wound. Cover the wound with a sterile gauze pads and tape or a simple band-aid. Take note, dress and clean the wound every day to make sure that it stays clean and unaffected. Steps for treating bruises. Immediately apply an ice pack in the bruise to reduce swelling. If possible, elevate the bruise area so that it is higher than the heart to prevent blood pooling in the affected area. Seek prompt medical help if there is any swelling around the bruise. This can signal danger to nerves, muscles, and bones.
Drowning. Turn the droning person's head to the side, allowing any water to drain from her mouth and nose. Turn the head back to the center. Begin mouth-to-mouth resuscitation in land or in the water if the injured person needs immediate life and death insurance. Put your ear near the mouth and watch the chest for any breathing movement. Check the pulse for signs of life. Tap or gently shake the victim. If the victim is still unconscious, go shout for help. Roll victim onto her back if necessary. Strengthen the victim's leg if necessary and move closest to you above victim's head. Roll the victim towards you. As you roll the victim, move your hand from shoulder to support back of the head and neck. Place the victim's arm nearest you alongside victim's body. Place one hand of the victim's forehead. Place finger of the other hand under bony part of lower jaw near chin. Tilt head and lift jaw. Avoid closing the victim's mouth. Place your ear over victim's mouth and nose. Look at the chest, listen, and feel for breathing about 3 to 5 seconds. Pinch nose shut. Open the mouth wide. Take a deep breath and make a side seal around a victim's mouth. Observe the chest. Maintain head sit with one hand on the forehead. Locate Adam's apple with middle and index finger of the hand closest to the victim's feet. Next, look, listen, and feel for breathing. About 3 to 5 seconds. Check the pulse every minute. Take the droning victim to the hospital for further medical help.
Fainting. Step-by-step guide for maintaining medical safety when a person fainted. Step 1. Place the fainted person in a prone position. Step 2. Loosen clothing if necessary to make sure the victim is comfortable and able to breathe clearly. Step 3. For basic life support, practice the airways, breathing, and circulation of first aid. Establish an open airway to start breathing. Make sure the person's airways are clear, breathing is regular, and circulation is normal. Step 4. Keep chin up to prevent the victim's tongue from obstructing the throat. Step 5. Wipe the victim's face with a damp, cool piece of cloth. Step 6. Follow the 5 minutes rule. If the victim remains unconscious or conscious but groggy, disoriented, and nauseated, it is best to call for medical help.